Have you ever wondered how medical misinformation can impact society? It's a question that's more relevant today than ever before. Medical misinformation, or the spread of health-related information that's not backed by sound science, can have dire consequences. It can lead to unnecessary panic, ineffective treatments, and even loss of life. On the flip side, accurate medical information can be a powerful tool in promoting health and preventing disease. In today's digital age, it's easier than ever for misinformation to spread like wildfire. That's why it's crucial to be able to distinguish fact from fiction. And to help us do just that, we're going to embark on a journey through time, exploring the top 5 most significant cases of medical misinformation throughout history. From misconceptions about vaccines to misguided beliefs about serious diseases, these examples serve as a stark reminder of the importance of reliable, science-based health information. So, without further ado, let's dive into the countdown of the top 5 most significant medical misinformation throughout history. Starting at number 5, we have the infamous misinformation, vaccines cause autism. This myth, born in the late 90s, has been a persistent and damaging one, causing fear and skepticism around the globe. The origin of this misinformation can be traced back to a controversial study published in 1998, which suggested a link between the MMR vaccine and autism. However, this study was later retracted due to serious ethical violations and falsified data. Despite the retraction, the myth spread like wildfire, fueled by sensationalist media and celebrity endorsements. This led to a significant decline in vaccination rates and an unfortunate resurgence of preventable diseases like measles and whooping cough. The impact of this misinformation has been far-reaching and detrimental to public health. Thankfully, rigorous scientific research has come to the rescue. Numerous studies involving millions of children have been conducted over the past 2 decades. These studies have consistently shown no link between any vaccine and the likelihood of developing autism. It's important to understand that correlation does not imply causation. Just because 2 events occur around the same time does not mean one caused the other. On the contrary, vaccines have been proven to be one of the most effective tools in preventing disease. They have saved countless lives and drastically reduced the incidence of diseases that were once widespread and deadly. Vaccines work by training our immune system to recognize and fight off harmful pathogens, thus providing us with immunity without having to suffer through the actual disease. It's essential to rely on credible sources for health information and to understand that the goal of vaccination is to protect individuals and the community at large. Vaccines have eradicated diseases like smallpox and are on the verge of eliminating others, like polio. Thus, it is clear that vaccines do not cause autism, but rather, they protect us from deadly diseases. Let's be vigilant about the information we consume and share, and continue to trust in science and the immense benefits of vaccination. At number 4, we have the harmful and discriminatory misinformation that HIV/AIDS is a gay disease. This myth took root during the early years of the AIDS epidemic in the 1980s, primarily in the United States. At this time, the disease was initially identified among gay men, leading to the misperception that it was exclusive to this community. This misunderstanding was further fueled by the stigma and discrimination against the gay community that was prevalent during this period. However, science shows us a different story. HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system. It is transmitted through certain body fluids that are infected with the virus, and this can occur regardless of one's sexual orientation. In fact, HIV transmission can occur through unprotected sex with anyone who has the virus, sharing of needles during drug use, or from mother to child during childbirth or breastfeeding. Moreover, AIDS, which stands for Acquired Immune Deficiency Syndrome, is a condition that can develop when HIV has caused serious damage to the immune system. And again, it is not exclusive to any one group of people. It can affect anyone, regardless of their sexual orientation, age, race, or geographical location. Over the years, global data has shown that HIV/AIDS affects all demographics. According to the World Health Organization, globally, an estimated 38 million people were living with HIV at the end of 2020. And this number includes people from all walks of life. It's crucial to understand that HIV/AIDS does not discriminate. It's a global issue that impacts individuals from all backgrounds and lifestyles. This myth, like all forms of misinformation, can cause harm by fostering discrimination and stigma and hindering efforts for prevention, testing, and treatment. So let's remember, HIV/AIDS is not a gay disease, it's a human disease, and the fight against it involves all of us, regardless of who we are or who we love. HIV/AIDS does not discriminate, and neither should we. Coming in at number 3 is the dangerous misinformation that cancer can be cured by diet alone. This myth has roots in the ancient belief that food is medicine, a philosophy that, while holding some truth, gets dangerously misinterpreted when applied to serious diseases like cancer. The idea that cancer could be cured solely through diet emerged in the mid-20th century, with claims that certain foods or diets could starve cancer cells or boost the immune system enough to fight off the disease. Over time, this myth has been perpetuated by sensationalist media, celebrity endorsements, and unfortunately some unscrupulous individuals looking to profit from the desperation of those fighting the disease. The danger of this misinformation lies in the potential delay or rejection of proven medical treatments for cancer. While it's true that a balanced diet can complement cancer treatments and improve overall health, it is not a standalone cure. Cancer is a complex disease that often requires aggressive treatments like surgery, radiation, and chemotherapy. These treatments are backed by rigorous scientific research and have saved countless lives. Many of the diets touted as cancer cures are not only ineffective, but can also be harmful. Extreme dietary changes can lead to malnutrition, weaken the immune system, and exacerbate the physical stress of the disease. It's essential to remember that while a healthy diet contributes to overall wellness, it is not a magic bullet against cancer. It's also worth noting that a one-size-fits-all diet doesn't exist. Everyone's dietary needs are unique and can change, especially when battling a disease like cancer. It's always best to consult with a healthcare professional or a registered dietitian when considering dietary changes. In conclusion, the belief that cancer can be cured by diet alone is not only misleading, but potentially harmful. Proper medical treatment is crucial in the fight against cancer. A balanced diet should be seen as a beneficial complement to these treatments, not a replacement. While a healthy diet is beneficial, it should not replace medical treatments for cancer. At number 2, we have the stigmatizing misinformation that mental health problems are a sign of weakness. This pervasive myth has long cast a shadow over those suffering from mental health problems, often causing them to feel isolated, misunderstood, and even guilty for their condition. But let's clear the air here. Mental health problems are not a sign of failing or lack of strength. They are, in fact, medical conditions that have roots in complex interplays of genetic, biological, personality, and environmental factors. Just as someone wouldn't choose to have diabetes or heart disease, no one chooses to have a mental health problem. Moreover, mental strength is not about avoiding problems or emotions. It's about acknowledging them, understanding them, and seeking help when needed. In fact, seeking help for mental health problems requires immense courage and resilience, the very opposite of weakness. Modern science and medicine have made significant strides in understanding and treating mental health issues, highlighting the importance of early intervention and professional help. However, the stigma associated with mental health often prevents individuals from seeking the help they need. So let's break the chain of this harmful misinformation. Let's foster an environment of empathy, understanding, and acceptance, where everyone feels comfortable seeking help. Mental health problems are not a sign of weakness, but a part of human health that needs care and understanding. And finally, at number 1, we have the recent and deadly misinformation that COVID-19 is just like the flu. This myth originated early in the pandemic, perhaps as a way of downplaying the severity of the virus or to quell rising panic. It was and continues to be perpetuated by various media outlets and individuals, leading to a lackadaisical attitude towards safety measures, and in turn, contributing to the rapid spread of the virus. But here's the truth. COVID-19 is not just like the flu. While both are viral illnesses that affect the respiratory system, there are crucial differences. COVID-19 is caused by a novel coronavirus, SARS-CoV-2, and it has shown to be more severe and deadly, particularly for certain high-risk groups. Moreover, COVID-19 can cause a range of complications that go beyond the respiratory system, affecting the heart, brain, and other organs. It's also marked by its high transmission rate and its ability to cause severe illness or death even in previously healthy individuals. The flu, while serious, has a lower mortality rate and is a disease we have more knowledge of and experience dealing with. We have annual flu vaccines and antiviral drugs to combat it. COVID-19, on the other hand, is a new disease, one the world is still grappling to understand and control. The misinformation that it's just like the flu has hindered our collective response to it. COVID-19 is not just like the flu, and understanding this is vital to combating the pandemic. Misinformation can cause serious harm, especially when it is about our health. Throughout history, we've seen this play out time and again. From the erroneous belief that vaccines cause autism, to the harmful stereotype that HIV/AIDS is a gay disease, misinformation has continuously misled the public. The myth that cancer can be cured by diet alone and the oversimplification that mental health problems signify weakness have both led to tragic consequences. Not to mention the recent misconception that COVID-19 is just like the flu, a falsehood that has resulted in countless preventable deaths. It's vital that we all strive to seek accurate medical information to protect ourselves and those around us. Let's not let history repeat itself. Remember, your health is important. Always seek accurate information. Don't forget to subscribe, follow, like, comment, and share. Stay informed, stay healthy.